As I was introduced, I'm a medical geneticist, but also a parent. And so many of the stories that and themes that John presents on Kate's story sort of ring true to all of us who've experienced a condition that's part of newborn screening. So today I'm here to underline the EverLife Foundation's activities recently to have our newborn screening community as a whole lead to this call to action. Next slide. So as the speakers before me have said, the promise is there. In 2019, FDA let us know that they would be approving 10 to 20 cell and gene therapy products by the year 2025. That number continues to increase on a daily basis. The current newborn screening system is just not to deliver on the promise of the advancements in research, both to screen, diagnose, treat, and manage these conditions. And as Kate's story highlights, every day is important. The SMA implementation across the United States is actually a success story in some ways as we look at conditions that have been added to the recommended uniform panel that Annie talked about. We did a survey, and on average, it takes about 9.5 years for all states to implement screening for a new condition. Today, as Annie pointed out, we have 31 conditions that are recommended to be screened, but potentially in the next several months and years, we'll have hundreds of conditions that could benefit from the early identification and treatment through newborn screening. We are hearing from leaders from across the newborn screening system that we have to do something to change. Next slide. So to support these steps for change, the EverLife Foundation brought together several key stakeholders to begin to consider what would it take to advance newborn screening. And this was termed as modernization. So thank you to everybody that's represented on this slide for your countless hours to help the EverLife Foundation and this group think through the next steps. And this is really to set up, once the Newborn Screening Saves Lives Reauthorization Act is passed, that we can hit the ground running. Next slide. The activity came up with 4 key goals, and these 4 key priorities, again, will set us up nicely once the bill is passed. So we'll be ready as a community to really deliver on this new funding and this new authorization to move these important activities forward. These 4 activities will not only help in the implementation of new conditions that have a novel screening technology or treatment, but also to look into the future and to make sure that we're ready to deliver on the promise of newborn screening for the next decades and years of our nation's children. Just that delay of 9.5 years or even 3.5 years in the story of Kate and SMA, we're talking about over 40 million babies that could have been screened and treated with these key therapies and life-saving and life-changing therapies. Next slide. And so moving forward, we invite the community to be part of the conversation and to support us in passing the Newborn Screening Saves Lives Act. And we will be publishing the findings from the modernization effort, and we look forward to encouraging you all to work alongside us and to prepare us to deliver on the promise of newborn screening. Thank you.